Hello and welcome back to Twig. Twig stands for This Week in Global Health. This is a weekly live global health news roundup. We've got an exciting show lined up for you today. We're going to carry on talking about health systems. Before we carry on, I'm going to ask the panel members that we've got tonight just to introduce themselves. We'll start off with Jessica. Jessica, over to you.
Hey everyone, I'm Jessica Taff, and I'm coming to you from the Washington, D.C. metro area where it's currently snowing, so I'm pretty excited about that. Not only am I excited about the snow, but I'm excited to tell you about vaccines and medical innovation that is crucial to a well-functioning health system.
Okay, I didn't know we were going to hear about the snow. That's exciting. It is not snowing in Dublin, just so that you know. Oh, by the way, my name's Greg Martin, coming to you from Dublin. All right, next, over to Sulzan. Sulzan, talk to us.
Hello everybody, this is Sulzan and I'm speaking to you from North Carolina, United States. It is not snowing here and I will be talking about supply chain and procurement of essential medicines.
Okay, brilliant. Thanks very much. And coming from where I imagine it's warmer on the west coast of America, Terry, talk to us.
So Greg, 74 degrees here in Southern California, and that's why I'm reading you today. I'm going to talk about vital registration systems. They're so important to health systems.
Okay, brilliant. Thanks very much. And Agnes from the CDC, and from where I'm sitting, Agnes's picture's frozen and she's on mute, so I don't know if she's able to respond. But I'll tell you, Agnes is coming to us from the CDC, and I can see she's got a terrific big smile on her face. Agnes, is your mic working?
I think it's working now. This is Agnes from CDC Atlanta. I'll be talking about pricing and some of the global mechanisms we have in place to make medicines more affordable to countries that cannot afford them in the developing world.
Thanks very much, Agnes. Right, so we're going to jump right into the show. Just to quickly give a little summary or update on what we talked about in the last show. We talked about health systems, and we spoke a little bit about universal access to healthcare, and we gave a bit of a definition for health systems. And really, health systems are the building blocks. We talk about 6 building blocks of health systems. You've got to have products that you can use to treat people. Those are medicines and diagnostics. You've got to have people that can give people treatments. You've got to have the human resources in place. You've got to have the health services distributed across the country so that everybody has equal and access to those products and those services. You've got to have the finances in place so that these things can be paid for. You've got to have the information systems in place so that you know what it is that you've got to buy and where it is that you need to intervene. And of course, you need to have leadership in place, leadership and governance. That's the final building block to make sure that this whole thing works. So that, in a nutshell, is health systems. I'm not sure it was a very coherent or articulate nutshell, but that's my little version of health systems. Right, I'm going to jump right in and ask Terry. Terry, if you can talk to us about vital registration systems.
So Greg, your definition of health systems is spot on correct. And one of those operating components is vital registration systems. So think in the context that we're going to take a trip together. Our trip is to improve global health. Well, how do we get there? We can only get there if we know where we are now. There's the problem. We don't have a good idea where we are now. The issues are that right today, 100,000 people will die today, and we don't know it. There's no registration system. That 2/3 of the people who die every year go unregistered. Today, half the children who are born will never be registered into a system. So we have no idea that their birth even occurred. And so we put this together, we have a real lack of data, a lack of information of where we're going on this journey that we so vitally need.
Terry, that's tremendously interesting, but now we were talking earlier, and isn't it the case, and perhaps you can give us a little bit of detail, that the WHO does have some kind of registration system and it's collecting information from countries, but I understand that it's not really at what we want it to be. Could you just talk us through a little bit about what's happening at a global level?
Of course, Greg. So let's bear in mind, the WHO, we would think, would have all the information it's needed. Well, where did they get the information? They get it from its member states. Remember, member states. People join. And so as a consequence, there's only about 100 countries out of the total audience of 200 approximately countries in the world who have data going to the WHO. So the WHO doesn't have the data. What they do have, they're very good at sharing with us, managing it, and making it available. But we need to get all these other 100 countries involved.
Right, super interesting. So basically what we're saying is approximately half the countries out there are not providing data to the WHO in terms of who's dying and what they're dying of and the burden of disease. And presumably, Terry, it's going to be countries where the needs for interventions are greater, that the availability of data is sparse.
Absolutely correct, Greg. Absolutely correct.
Okay. Well, you know, the need for data, the need for information and health information systems is part of what tells us what it is that we need to do, how it is that we need to intervene, what products and services need to be provided. And I'm going to ask Jessica if she can talk to us a little bit about access to medicines. And just so that you know, we're talking about products, we're talking about vaccines, medicines, diagnostics, etc., etc. Jessica, access to medicines.
Absolutely, right. Okay, so this is definitely a very important part of health systems. You know, thinking about medicines and health technologies and how they factor into a well-functioning health system. In fact, WHO identified this as one of the 6 health system building blocks and specifically flagged access to medicines as a very important issue. Increasing access to medicines requires a systems approach. There's just so many players that are involved in the process, from research and production to regulation and financing to demand, and then finally to delivery. And at all these levels, innovation is important, and it can facilitate access to medicines within a larger health system. For instance, it includes developing new drugs, medical technologies, novel use of existing medical and information technologies, changes within procurement and delivery systems, new financing strategies, and finally, even just having different policy changes that promote better access to medicines.
Jessica, you were talking earlier on about a recent innovation. Could you just kind of reflect on that?
Yeah, absolutely. All right. So a really good example of how innovation has facilitated greater access to medical technology within a health system is the meningitis A vaccine. Now, this vaccine was available before, and it obviously is against meningitis disease, which is a big problem globally and kills many people, especially children. Now, this vaccine was made heat stable through freeze drying by the Indian vaccine manufacturer, the Serum Institute. Now, this innovation allowed the vaccine to maintain potency outside of cold storage conditions, and it extended the time in which the vaccine could be delivered. So this innovation has been called a game changer in terms of meningitis control, and especially in rural conditions in which access to electricity and cold storage is limited. So again, you know, here's particularly where innovation on maybe biomedical technology is definitely increasing access to medicines and within the larger health system.
Okay, fantastic. Thanks very much, Jessica. Now, we've talked about you need information to know what it is that you've got to, what it is that people need, what services and products are needed. Then we've said, okay, there's innovation, we've got new products in the pipeline, very exciting. Next important thing is we need to get those products to the right people, right? And this is what we call procurement and supply chain management. It starts off very simply with demand forecasting. Then, of course, there needs to be a procurement process. That's the process whereby countries actually place an order and they buy the goods. These things need to be delivered to the countries. They have to be warehoused. From the warehouses, they have to be distributed to the different clinics in the countries. And then, of course, there needs to be inventory management and rational use of the products by the end users. So that's kind of the procurement and supply chain management. These are the stepping stones. Sulzan, I'm going to ask you just to talk a little bit about that in a bit more detail.
Absolutely. So, Greg, did you know that facility-level stockouts and poor availability of medicines is actually one of the most common reasons for underperformance of health programs?
Okay. I didn't know that, but I'm glad you brought it up.
Yeah. So when supply chains falter, the health impact can be devastating. For example, there's a report by Stop Stockout Project in South Africa, which mentions that 1 in 5 health facilities in South Africa reported stockouts of an average length of 30 days for antiretroviral drugs and tuberculosis drugs, which affected over 420,000 people. So that's the kind of impact.
That's a lot of people.
Yeah.
Yeah. Oh, so can I just interject, because you're talking about South Africa and the supply chain. I do know something that has been going on, I think, at least since 2013. I think I saw the article on it. But the busiest clinic in South Africa, the HIV clinic, is the Themba Lethu clinic. And they've implemented an automated system that delivers ARVs. So it links in information systems. Doctors can put in a script for a patient, and so this is all kind of cloud-based. And then a patient can go in there and access medicines like through a robotic machine. And this is a fantastic innovation. Like I said, this is the busiest clinic in South Africa, and they used to have waiting times for patients to get their medicines that were 4 hours, and it's gone down to 18 minutes. And it has also addressed like the stock issue, because these machines can kind of figure out how much medicines are left and who's going to in need of them. So it has also limited the loss of stock due to the drug expiry issues as well. So, and this saved the Department of Health millions of money.
That is
amazing.
Yeah, that sounds definitely very amazing, and so definitely innovation is very important when it comes to improving access to medicines. But along with innovation, you also need like effective implementation, and supply chain is a larger issue, because shortage of drugs, because of maybe improper distribution of drugs, inefficient in-country supply chain models can have devastating health impacts, not only reduced access to drugs, but also, increased wastage. There are drugs there, which are being stored in facilities which are expired, and no one knows they're expired. So it has a wide range of impact. And why supply chain is really important from a health systems level is because both information systems and medical product and technology are knobs of health systems which are tied together with supply chain, which includes procurement and distribution of medicines. I believe Agnes will be talking in detail about the procurement, and Terry talked about information systems, which is so critical for efficient supply chain. And just very quickly, Greg,
I was going to say to you, before we hand over to Agnes, could you tell us a little bit about the different models of procurement and supply chain management?
Sure, yeah. So there are various supply chain in-country models depending on whether financing is public or private, or whether the distribution at both wholesale and retail level is public or private. So there are a couple of models like the central medical store model, which is often a traditional supply system model, which is across Latin America and a lot of other countries. It's very popular, in which medicines are procured and distributed by a centralized government unit. Then there is the autonomous supply agency model, in which the bulk procurement occurs and is managed by an autonomous agency, but again in a very centralized manner. And then there are the two decentralized models, like the direct delivery system, which is a decentralized approach where the suppliers directly provide the medicines to the districts and regions rather than through a central unit. And there's also the private system where both the procurement and supply is managed by private enterprises. So depending on which, there's no like right fit, but every country has a different set of needs and a different system which works.
Okay, very nice. Now, let me see if I can weave a little thread through everything that we've been talking about tonight. Well, tonight my time, daytime your time, I understand. But so Terry was saying, look, we need information systems. We need information about what the need is, where the burden of disease is. Right, so now we know, let's say we know what needs to be done. The next thing is we need products. We need innovation. We need the right products for the right people and the right diseases. And Jessica talked about that and the fact that we need this access to medicines. To get these medicines to the right people, of course, we need efficient supply chain management and procurement mechanisms. So that's where we're at the moment. But this doesn't always work. And so I'm going to ask Agnes to talk to us a little bit about some of the barriers that sometimes prevent all of this falling into place and translating into healthcare for people. Agnes, over to you.
Thank you very much, Greg. I'm going to be focusing on the barrier of prohibitive costs for diagnostics, for drugs and diagnostics. As we know, research and development for some of these products is very costly. And at the end of it all, most of the countries in the developing world are not able to afford some of these medicines. For example, if we look at the vaccine, the pentavalent vaccine, if it was to go for the U.S. Market price to be going for $30, and most of these countries wouldn't be able to afford that. So what some of the global mechanisms that are in place to make some of these products more affordable and accessible to some of these countries. But again, we are looking at very high expenses in health systems for medicines. If you look at the case that was recorded by WHO, we have 67% of the total health expenditure in the low and middle income countries being spent on procurement and distribution of medicines in some of these countries. And most of, if you look at the household level, most of these expenses are being footed by the household themselves, which cannot even afford to buy some of the best needs in life.
Okay, Agnes, that's really interesting. Can you perhaps give us a little bit of a window in to what's been done globally? What are the mechanisms that are in place at that sort of global health level that are going to mitigate some of these problems that you've highlighted?
So what has been happening very interesting in the past 2 decades is that we've had really the global health community coming together to increase access and also to make some of these products affordable to countries in the developing world, especially in Africa, and also especially for HIV, TB, and malaria and vaccines. So we look at the work that has been done by the Global Alliance for Vaccine Initiative, Gavi, in short, which was created in 2000 to improve access to new and underused vaccines for children living in the developing world. We've seen a very successful story, like I was saying earlier on for the pentavirus. The countries that are supported and eligible to receive products from Gavi, they are now accessing this vaccine for only $1 compared to what it would be for $30 in the US. The other example, actually, it's the work done by UNITAID, which is part of the United Nations. They are using very innovative financing to increase access to treatments for HIV, malaria, and tuberculosis. They've been able to expand access to 52,000 people living with drug-resistant TB in some of the countries where they're supporting and have very successful collaborations. We also have the Global Fund for fighting AIDS, tuberculosis, and malaria. They have such a very big budget of $4 billion, but they are actually spending 40% of that budget on just procurement and distribution of drugs in the developing countries. HIV was one of the very complicated diseases in the beginning, and a lot of countries they really had a challenge of access to ARVs. But now we can say we have 7.3 million people living with HIV on ARV therapy in most of the countries in Africa and some in Asia. We also have FIND, which is the Foundation for Innovative and New Diagnostics. They've been working with a lot of players on the global level to increase research for diagnostics and also increasing access to those same products in the developing world. For example, they've been working extensively in increasing testing and access to the testing of drug resistance for tuberculosis in Africa and also in Asia.
That is so interesting.
But again, there are also other.
Agnes,
I was saying that again, there are also other. I was saying there are also other mechanisms that have not been able to pull in that I'm sure will be found in the notes. For example, PEPFAR, World Bank, they're also doing such amazing work in access to some of these products. But again, you could always find more of this information in the show notes as you walk through it.
I really love how you presented the Agnes, because your section covered the most important issue when we talk about health systems. It covers the knobs like the financing. It talked about information system, and talking about information system and other health system knobs. I came across a very interesting quote on USAID's website, which said, "Data in our hands leads to medicines in their hands." And that is what information system is about. And information system, yeah, it's a great code. And supply chain, help in forecasting and ensuring that medicines are available when people need them.
Okay, yeah. I like it a lot. Jessica, you're going to tell us a little bit about a call for proposals that's out there?
Yeah, before we finish up tonight, I think we've talked about everything we need to talk about in terms of medicines and information technology. And let me just finish up by saying that, because especially one of the things I talked about is innovation for medicines, and this is obviously very important for the health systems. I'm telling to let everybody know that Medicines for Malaria Venture has put out a call for scientific proposals on new medicines for malaria. And this is to address different stages of the parasite, drug resistance, and that proposals that are within the priorities of the global eradication agenda. Now, these proposals are due by March 31st, and you can find out more information in our show notes or on our Facebook page. We'll also post some information as well. So get on it, guys.
Okay, thanks very much, Jessica. Okay, so just a reminder, of course, you may be watching this on YouTube at some point in the future if you're not watching this live right now. We've also got a podcast. You could watch the podcast, listen to the podcast in an audio version of the show. You can just get that at iTunes, or we should have a link on our webpage somewhere where you can click on it to subscribe to the RSS feed on Android. I'm not quite sure how that works, though. And, of course, we've got show notes that go out with all the links, etc., to what we've been talking about. Thanks for watching. As always, don't do drugs, don't ever change. We'll see you here, same time, same place, next week.
And be careful in the snow. Bye.